This is our type 2 diabetes mellitus PowerPoint for our PathoFlow. Hi, this is Lauren, and I'm going to be going over the etiology and risk factors for diabetes mellitus type 2. So, cells in the muscle, fat, and the liver become resistant to insulin when you have diabetes mellitus type 2, and because of this, cells don't interact in a normal way with insulin, meaning they won't take in enough sugar. This is because insulin ultimately helps in aiding the cells and muscles to absorb sugar. So without sugar absorption, the blood sugar will drop and rise irregularly. Another cause is the pancreas is unable to produce enough insulin to manage blood sugar levels. So once again, there's drops and rises. One of the other causes is genetic environmental factors, so as in walkability or physical activity. These are two big factors in keeping up your health and keeping your weight at a stable level. At the top, I have that most of the time the cause of DM type 2 is unknown, which is because ultimately we're not sure why insulin doesn't interact with cells normally, and taking in sugar, we're not exactly sure the background behind this. So now I'm going to be going over the risk factors. So one of the number one risk factors is being overweight or obese. This puts you at really high risk for developing and being diagnosed with DM type 2. Age is also another factor. So if you're 35 or older, this is where you're at most risk for developing DM type 2. Children and teens can also develop DM type 2, but the risk only gets higher as you get older. Family history of diabetes mellitus type 2 is also a big factor. So if your mom or sibling has it, you're more likely to develop it. Your ethnicity is also a big factor, because if you're African American, American Indian, Asian American, Hispanic, Latino, or Pacific Islander, you are more at risk for developing DM type 2. Sedentary lifestyle, as in if you're not active or if you have a job that requires you to sit for long periods of time, this also causes you to be at higher risk for DM type 2. And that also leads into your weight, and being active helps keep you at a good level. If you have pre-diabetes, that also puts you at risk for DM type 2, because if you already have all of the indicators for DM type 2, you're just more likely to develop it.
Hi, my name is Tiffany, and today I'll be talking about the clinical manifestations of type 2 diabetes, which are nonspecific, meaning they are presented by broad symptoms that can be caused by a variety of health conditions. Many people will present with classic diabetic symptoms such as increased thirst, frequent urination, and delayed wound healing. As glucose builds up in the bloodstream, people become hyperglycemic, which often leads to microvascular complications such as retinopathy, which is damage to the retina, and this causes blurred vision or visual changes. Another microvascular complication would be neuropathy, which is damage to the nerves, and as a result, an individual may experience paresthesias, which in layman's terms is numbing or tingling of the hands and feet. Other clinical manifestations that are associated with this disease are areas of darkened skin, usually in the armpits or around the base of the neck, unintended weight loss, and pruritus, which is itchy, dry skin. Many individuals experience fatigue and frequent recurring infections. An individual's immune system will weaken over time as a result of poorly controlled blood glucose levels, and this makes it difficult for your body to fight infections.
The most common diagnostic tests for type 2 diabetes are the fasting blood sugar test, the glucose tolerance test, and the A1C test. The fasting blood sugar test measures your blood sugar after an overnight fast. A fasting blood sugar level of 99 milligrams per deciliter or lower is normal. 100 to 125 milligrams per deciliter indicates you have prediabetes, and 126 milligrams per deciliter or higher indicates that you have diabetes. Glucose tolerance test measures your blood sugar before and after you drink a liquid that contains glucose. You'll fast overnight before the test and have your blood drawn to determine your fasting blood sugar level. Then you'll drink the liquid and have your blood sugar level checked 1 hour, 2 hours, and possibly 3 hours afterwards. At 2 hours, a blood sugar level of 140 milligrams per deciliter or lower is considered normal. 140 to 199 milligrams per deciliter indicates you have prediabetes, and 200 milligrams per deciliter or higher indicates that you have diabetes. Lastly, the A1C test measures your average blood sugar level over the past 2 or 3 months. An A1C below 5.7% is normal, between 5.7 and 6.4 indicates you have prediabetes, and 6.5 or higher indicates you have diabetes.
Weight reduction, medication, checking blood sugar, blood pressure, cholesterol levels regularly, as well as seeing an eye doctor and a foot specialist annually are ways to manage type 2 diabetes. An effective diabetes management plan may consist of a healthy diet, and a healthy diet may look like eating whole grain products, monounsaturated oils, fresh fruits, and vegetables. Type 2 diabetics may eat foods that are low in carbs, low in cholesterol and saturated fats, low in trans fats, and they must maintain a low total calorie intake. An effective diabetes management plan may also include exercise. Regular exercise can help in managing weight and blood sugar. It may lower cardiovascular risk factors, and it reduces the risk of heart attack and stroke. Exercise increases general health and well-being. Aerobic exercise like swimming, jump roping, walking, or cycling is recommended among type 2 diabetes patients. Type 2 diabetes patients must also monitor their blood sugar levels, blood pressure, and cholesterol levels. A self-monitoring blood glucose device may be used to monitor blood sugar levels at home. Personal blood sugar targets can be determined with the help of a doctor. This could depend on age, health, and diabetes management. Diabetics also have a higher risk of developing high blood pressure compared to non-diabetics, which is why it's important for type 2 diabetes patients to check their blood pressure regularly and their cholesterol levels. It may be helpful for type 2 diabetes patients to visit an eye doctor and a foot specialist every year. Patients with diabetes are at a higher risk of foot complications like fungal infections, blisters, ingrown toenails, and athlete's foot due to poor blood flow, which slows down their wound healing. Eye problems like cataracts, glaucoma, and retinopathy can also progress more quickly in patients with diabetes, which is why it's important for them to visit an eye doctor every year. If none of the other methods are effective, doctor may prescribe medications. These medications may come in an insulin, injectable medications, or oral diabetes medications. Patients with type 2 diabetes may also consider taking low-dose aspirin, which reduces the risk of heart-related problems.
The following are classes of medications used to treat diabetes: alpha-glucosidase inhibitors, biguanides, bile acid sequestrants, dopamine 2 agonists, DPP4 inhibitors, meglitinides, SGLT2 inhibitors, sulfonylureas, TZDs, and oral combination therapy. Metformin, also known as glucophage, Riomet, or Glumetza, is a drug that reduces the amount of glucose produced by the body and has been used for a long time. It is the best studied diabetes medication, as well as one of the best tolerated. For this reason, doctors usually recommend trying metformin first. The possible side effects include diarrhea and feeling unwell, especially if metformin isn't taken together with a meal. In very rare cases, about 1 out of 10,000 a year, people with type 2 diabetes who take metformin develop acidosis. This is a medical term for too much acid in the blood, which can lead to breathing problems, nausea, or circulatory shock. Because of this, people with decreased kidney function, decreased heart function, or alcohol dependence aren't usually allowed to take metformin.
Okay, this is Lori Fell. For my part, it's the key points for patient education for diabetes. Patient needs to know about nutrition. They need to control their diet, like eating whole grain products, monounsaturated oils, fresh vegetable, and fruits. They also need to know that they should be active and do exercises in order for them to help to control blood pressure, lowering bad cholesterol. And then patients also needs to know about the signs and symptoms of hypoglycemia and hyperglycemia. So just in case something happen or they will feel something shaking or sweating, they should know what they're supposed to do in this situation. One of the key points for patient education is teaching how to manage their blood sugar. They should know how to check their blood sugar and when and what's the target number. And normally for the diabetic patient, before they eat their meal, they're supposed to have the 70 to 130 blood sugar. That's supposed to be their target number. And patients needs to know also and follow their care schedule like blood sugar test, doctor's visit, and A1C test. This test result is needed to modify if medications if needed to meet the client's health goal.